about mammography. I hear it hurts.
Welcome back to Health in Today's Woman. To better answer this question, we took a trip to the Comprehensive Breast Center at the new facility for the Murfreesboro Medical Clinic. Today we'll be joined by Dr. Rebecca Baskin, who will help educate us on the tools used to diagnose and treat breast disease. We want to thank Dr. Baskin for being here today. This is a mammogram machine. This is one way to evaluate the breast. Dr. Baskin will now explain how this procedure is done.
As the young lady we talked to before had something that she had found concerning her breast, or her physician may have found something concerning her breast, the next step for those ladies that are over 30 are actually to have a mammogram, and this is one of those such machines. In this machine, the lady will be standing. They will place her breast here in the machine and put some mild compression. Then an x-ray beam is actually shot through the breast, and then a film captures the image, and that picture is read by the radiologist. I know that the lady did have a question, and many ladies are concerned about, does this hurt? And it's really about having an open communication with your technologist. They're very attuned to some of the fear or worry that ladies have. And once you talk with them and let them know if you ever have any discomfort or you're reaching to the point where the compression is just enough, then tell your technologist and she will stop at that point and take the film.
One of the things that you mentioned, which is very important, is that they create an x-ray. Next, we're going to go look and see what that x-ray looks like. In our last segment, we discussed the fact that the mammogram machine creates an x-ray image. Now we're back with Dr. Baskin, who explained those x-ray images to us.
This is an example of a normal mammogram. When the views are taken, this is a side view as the breast is compressed from side to side. And this is a CC view, or as the breast is compressed from top to bottom. If something is seen in one view, it is then looked at in the separate view, and if it is in both views, it is considered to be a real entity and therefore must be further examined. As you can see on here, we're looking at chest wall and then breast, and here mostly just breast is seen all the way back to the chest wall. On this mammogram, these are an example of an abnormal mammogram. Here it's fairly subtle, but you see this wider area here in the center that has irregular or spiculated edges here and here. So now we've seen it in two views, and it even has a little white speck in it or calcium in it. This is considered suspicious and will need further evaluation and most likely a biopsy. This is another example of an abnormal mammogram. You see this triangular mark. This is put here because this lady was feeling something in her breast, and this is a picture of it on mammogram in two views. Because it is very regular and rounded, we're not sure quite what this is. It could be cyst or solid, it could be concerning or not concerning, and therefore would usually require further workup, usually with ultrasound.
Some women will require biopsy to determine whether the mass is cancerous or non-cancerous. Dr. Baskin, can you explain to us a little bit about how this table relates to women in the diagnosis and treatment of breast disease?
Yes. This is called a stereotactic table, and this is one of the ways that we have to do minimally invasive biopsies. This is for those calcifications or masses that show up on mammogram in two views. Minimally invasive means that the lady can have this procedure done as an outpatient in a short amount of time with a very tiny incision, lots of local numbing medicine, a little bit of anti-anxiety medicine, and be able to have this done here as an outpatient. Now, the lady will lay on this table face down, basically actually looking off to the side with her breasts hanging down through this hole in the table. And this paddle is part of what it's held in compression against. Then this arm takes x-rays just like we saw in a mammogram machine, and these films are filtered through the computer, and the computer helps guide my needle through the very tiny incision to the right place in the breast to take little slices of the breast tissue so that we can get a very accurate diagnosis.
Some women are candidates for additional testing. One of those tests is the breast MRI. Dr. Baskin, can you explain to us a little bit how the breast MRI works and who's a good candidate for it?
Sure. Now, breast MRIs are not for the general public or every woman. It is not a good screening test. The mammogram is still for that. But breast MRI is used for those ladies that are considered higher risk or very difficult to get good mammogram films. Those high-risk ladies oftentimes are ladies that have already had a breast cancer diagnosed or treated, those who have had radiation to the breast, implants, or those ladies that are relatives of first-degree relatives that have breast cancer, and those would include mother, sister, or daughter, especially those under the age of 50. The MRI actually takes a very different view of the breast and actually shows not just the anatomy, but blood flow going in and out of the breast. And that's what makes a lesion in the breast look suspicious or not. Here, the lady lays here. This is the head or the face cradle. The breasts drop through here, so both breasts are MRI'd at the same time, and the legs would go in this direction. And as you can tell, this is a very nice table. This is, I believe, the only one here in Middle Tennessee that is used with, has all the extra padding and is an entire table just specifically for this test, for a breast MRI.
After the break, we will again be joined by Dr. Carter and Dr. Baskin in the studio, where we will continue to discuss breast disease.